Welcome back to Empowerment Nursing. I'm Linda and this is Ashley, and we are nurse educators. You are tuning into our series In the Know, where we make it simple. Today we are simplifying aldosterone. Aldosterone is a concept that comes up frequently in content review, and it really enhances your understanding of multiple concepts, disease processes, and nursing interventions.
Before we get started diving into aldosterone, what makes it so important and how it can help you come to the right answer, as always, we like to invite you to subscribe to us. Regardless of where you're joining us from, be it on Facebook or YouTube, you can press the subscribe button and be notified whenever we release new content, which is usually on a weekly basis. 3 times per week, we kind of share stuff out there. You can also follow us on Facebook, join us on our YouTube channel, or check out our website at www.n-powermentnursing.com, where you can see our entire empowerment nursing prep packages. There's something there for everybody. So give us a shout out, comment below, let us know where you're watching from, what you'd like to see us do videos on in the future. We always love to know and hear from you where we are reaching. So before we get started with aldosterone, we just want to show you the page in our textbook. This page, aldosterone, of course, is one of the, if you're studying with us, you will know, one of the 3 A's of hormonal fluid regulation. And aldosterone is super important. By hormonal fluid regulation, that's just a nursey term for blood pressure and what keeps our blood pressure normalized. So we're going to talk about one of those 3 A's today. Very, very important guy. In my mind, aldosterone is a guy. I don't know why. Your aldosterone might be a girl. That's okay. And I'm just going to draw a little something on the board here about how aldosterone acts in our body and how you can use that to come to the right answer. So if you can think about aldosterone kind of like a check engine light, aldosterone responds to low blood pressure. Okay, so when your blood pressure goes too low, meaning normal blood pressure is 100 to 139 over 60 to 89. So anytime your blood pressure goes lower than that, aldosterone is like a check engine light that's going to respond to low blood pressure to bring you back to normal blood pressure, which we all know as nurses as homeostasis. So how aldosterone works in the body is it responds to low blood pressure, and it has its response by increasing sodium retention. I'm a big fan of using pictures to help us remember things, so we're going to draw a salt shaker there. That's my salt shaker anyways. It acts on sodium. So when it causes us to retain sodium, much like if you go to McDonald's and you eat a supersized fry and it's got tons of salt on it, that will also cause you to retain fluid, right? So we retain sodium, then we retain fluid or water, because water also chases salt. So when that happens, when you retain water, your volume increases. And let's talk about when increasing volume happens, this increases blood pressure. If you didn't catch a video we did quite a while ago using a garden hose, it's a great analogy on how increasing volume increases pressure. To get that into your brain in kind of a simplified way, if you want more water pressure in your taps or in your shower, one thing we all do, but we don't know we're doing it, is we turn up the volume, right? So whenever you turn up the volume of water, you're going to increase pressure. So simplifying how aldosterone works, we go from aldosterone responding to low blood pressure. You get sodium retention, which causes water retention. When we retain water, our blood pressure goes up because increasing volume increases pressure. So this is how aldosterone works. Now I'm going to talk about how just knowing how aldosterone works is going to serve you in terms of getting the answers to questions, okay? So for example, Addison's and Cushing's disease are 2 diseases that are very heavily taught in nursing education and very heavily tested on your registration exam. So if you can understand that Cushing's disease is an excess of aldosterone, and you know what aldosterone does, then you're going to know that people with Cushing's disease retain sodium. When they retain sodium, they retain water to too much of an extent. When they retain too much water, they get too high of a blood pressure. So these individuals are going to have high blood pressure, edema, increased pulse rate due to that high blood pressure. Then if you know that aldosterone and Cushing's disease is related to sodium, if you know that sodium and potassium have an inverse relationship, if Cushing's patients retain sodium, they're losing potassium, so they're going to have low potassium. Then you compare this to Addison's disease, and going back just to knowing what aldosterone is, Addison's disease, I have that in my mind of you need to add stuff to them. So they have a lack of aldosterone. So if you don't have enough aldosterone, you're not retaining any sodium, you're therefore not retaining any water, therefore not retaining volume, retaining pressure. So they have low blood pressure as opposed to high, low circulatory volume, a huge risk for shock. Because they have low sodium, they have high potassium. So as you can see, just by understanding thoroughly what aldosterone is and how it works in the body, it's going to help you come to the right answer with multiple questions, okay? So we hope this has helped simplify aldosterone for you. One simple concept going back to first year nursing and how it is threaded throughout. Excuse me, sorry. And it's actually threaded more than that throughout multiple disease processes within our study textbook. It keeps coming up all the time, coming back to aldosterone. So we hope that knowing this concept alone will help you come to the right answer on your registration exam. Aldosterone is a super important concept, not just in studying for your registration exam, but in nursing as well, right? When you can recognize this in a patient and know how to respond appropriately.
If you're looking to gain all the content, critical thinking, and confidence you need to pass your registration exam, we have complete NCLEX, NCLEX PN, and CPNRE course packages. We guarantee you will pass or your money back. Thank you so much for joining us for next time in the know.
Bye for now.